2-minute anaesthesia, pharmacology, pharacodynamics, neuromuscular blocking drugs. The ideal properties of a neuromuscular blocking drug are listed on this slide. They can be split up into pharmaceutical, pharmacokinetic, and pharmacodynamic. All the neuromuscular blocking drugs available in the UK are quaternary ammonium compounds. As these are structurally related to acetylcholine, they bind to the alpha subunit of the nicotinic acetylcholine receptor. The number of quaternary ammonium groups can vary between 1 and 2 between agents. However, the agents with 2 groups are more potent, and these are starred in the table. Neuromuscular blocking drugs can be classified into depolarizing and non-depolarizing. Depolarizing includes suxamethonium. This is a non-competitive agonist. It's composed of 2 acetylcholine molecules joined by an acetyl group. Therefore, it acts like 2 acetylcholine molecules, so it binds to the receptor, leading to opening of the receptor. Whilst non-depolarizing agents are competitive antagonists, so these bind to the receptor and therefore prevent acetylcholine from binding. These are either aminosteroids or benzalkoniums, and the agents are listed on the table. The nicotinic acetylcholine receptor is a pentameric ionotropic receptor. It does not require secondary messengers. It has a molecular weight of 290 kilodaltons. It has 2 acetylcholine binding sites. Once acetylcholine binds, this leads to a conformational change and ion exchange, calcium sodium in, potassium efflux. The composition of the subunits vary between adults and fetus. In the adults, it's 2 alpha, beta, delta, epsilon, whilst fetal, it's gamma instead of the epsilon. The fetal subunits result in an increased duration of action and reduced ion conduction. The image on the right hand side shows nicotinic acetylcholine receptor and suxamethonium above. As it is composed of 2 acetylcholine molecules, it binds to the receptor, allowing sodium and calcium influx. The neuromuscular junction will be fully discussed in a specific talk, but briefly, acetylcholine diffuses across the neuromuscular junction and binds to the postsynaptic membrane at the nicotinic acetylcholine receptor. This requires 2 molecules of acetylcholine, resulting in a conformational change, sodium-calcium entry, potassium efflux. Action potential is generated. This moves down the T-tubule, increasing intracellular calcium, leading to excitation-contraction coupling. As we've discussed, neuromuscular blocking drugs are either depolarizing suxamethonium, which contains 2 acetylcholine molecules and therefore binds to the nicotinic acetylcholine receptor, leading to activation, muscular contraction, and then relaxation, whilst non-depolarizing agents, for example rocuronium, bind to the nicotinic acetylcholine receptor, prevent the binding of acetylcholine, ultimately resulting in paralysis.